Hello, I'm Guillermo Garcia-Manero from MD Anderson Cancer Center. I'm here at the ASCO meeting in Chicago, and tomorrow we are going to have a couple of interesting presentations in myelodysplastic syndromes. The first one I'm going to mention is by Dr. Zeidan on Luspatercept, and I also have to mention that actually at EHA meeting in Madrid in a couple of weeks, actually we're going to have quite a bit of updates from the original COMMANDS trial. So basically what we presented at ASH this past December in San Diego was the final update on the COMMANDS trial. This was first presented at actually at ASCO last year, was a very important presentation, and then EHA we published the paper in Lancet, but that was actually with the preliminary data analysis. So what we did at the ASH meeting last year, I had the opportunity to present as an oral podium, was actually the final update of the COMMANDS trial. So I think that update that is going to be re-presented by Dr. Zeidan at this ASCO meeting is going to clearly show that Luspatercept, when compared to an erythropoietin-stimulating agent in frontline transfusion-dependent patients with low-risk MDS and anemia, is actually superior in response and duration of response compared to the standard of care. I think that data is really now quite clear, and this will be, again, I think, clearly demonstrated by the presentation at the ASCO meeting. There's actually a manuscript that is under review. Of course, I don't know if this is going to be accepted or not, but we hope that this will also come out with that final report in the next few months. Also, this is very important with this kind of chronic therapy in patients with lower risk disease. Subsequent follow-ups on initial analysis that we had performed actually with the original MEDALIST and COMMANDS trial are going to be presented in Madrid at the EHA meeting, the European Hematology Association meeting. So we're going to see, again, an update on COMMANDS trial. We're going to see new tools for evaluation of update response criteria. And another presentation that I'm actually deeply involved is going to be around 3 lineage responses with Luspatercept, something that we had seen in MEDALIST, basically when we were giving Luspatercept as a second-line agent in ring sideroblastic anemia. The question here, do we see the same type of phenomenon in now on frontline COMMANDS patients? So I look forward perhaps to invite myself to another session like this in Madrid with BCT and give you a final update on all those very exciting presentations on Luspatercept.